We'll see the next question.
Hi ma'am, I'm Ruby Fatim. I'm a second year MBBS student in studying Cochin Medical College. I have read in magazine about cervical cancer vaccine. Is it really effective and what are the side effects?
Cervical cancer vaccine is a wonderful drug which has come up in the last few years. It's very effective. Like you can prevent up to 70% of all cervical cancers if you get all the 3 doses of this vaccine. And as I have told, up to 30% cancers cannot be prevented because this vaccine is focused, or it fights against certain type of human papillomaviruses which cause 99% of all cervical cancers. So there are 2 types of vaccine presently available. One fights against the 2 most common type of cancer causing human papillomaviruses. The other one fights against 4 type of viruses. So these are the common viruses. So sometimes cervical cancer can be caused by some other viruses as well. So this is recommended at around 11 to 13 years for all girls, and you can come down even up to as low as 9 years, and the upper limit of recommended age is 26 years. So in our Indian scenario, especially when our girls become sexually active at a later age, so you can even give it as I've told, maybe 16 years or 18 years at any time. So it's quite effective. And you've also asked about the side effects. Side effects are quite very rare actually, and even if side effects occur, they are pain, some dizziness, and some headaches kind of things. It doesn't cause any serious side effects. And about the long-term studies about this vaccine, we have got data about 6 to 7 years. There is the studies have shown that the immunity against the viruses have not come down at all after 6 to 7 years of follow-up. We need to wait for some more years to get more data about it.
Doctor, how many doses we have to take?
It is 3 doses, which is given at an interval of about 3 to 6 months. Once you complete the 3 doses of vaccination, you can expect to have a lifelong immunity. So that is what we know at present.
It protects only the cervical cancer.
It does. As I told you, there are two vaccines. The one which the quadrivalent vaccine also protects against certain non-cancer tumors like genital warts. So they are also helpful in preventing these as well.
Okay,
yes. And another interesting fact is that even in Western countries, people even give it to boys, because sexual transmission, if you prevent boys getting human papillomaviruses, you can as well prevent it getting transmitted to girls.
That means it's a sexually transmitted
It is definitely a sexually transmitted disease. Yes.
Okay, we'll see the next question, doctor.
Hi ma'am, I'm Ida Mary from CMC Kochi. I've got a question. My friend has severe pain during her periods. The scan said that she has endometriosis. So what's the best treatment for her?
Endometriosis is something which is very common nowadays. That is basically the lining of the inside lining of the womb or the uterus happens to be sometimes on the ovaries and rest of the lower part of your abdomen. So when you get periods, it will bleed in the abnormal location and you get pain. So as your friend is having endometriosis, but I presume that she's not married. So presently it is better to go for any medical treatment. First of all, good painkillers at the time when she has periods, and if it's not getting control with that, she can go on hormone tablets, say for a period of 3 to 6 months. And one suggestion which I have for her is to get married as soon as possible and maybe plan your childbirth. And at any stage, if she finds it difficult to conceive, she can as well go for surgery. And so surgery is recommended primarily for those who have already married. And immediately after surgery is the best time for her to conceive. And again, repeat surgery is not advocated, because each time you do surgery for endometriosis, you are damaging the ovaries. So that will have an impact on your future childbearing capacity.
Doctor, this endometriosis, is it related to cancer?
Not really. Endometriosis as such is not cancer. It is not abnormal. It is the normal endometrium which is present in abnormal location. So it doesn't multiply very fast like cancer. But there are a few type of cancers which can occur in a pre-existing endometriomas, but that's quite rare. So the primary concern about endometriosis is the pain the pain as well as the difficulty to become pregnant, and the long term implication is that it will affect the overall emotional function of the patient, and sometimes they may need to undergo hysterectomy. So it is not related to cancer.